Hi, my name is Dr. Mabowa Makhomisane. Today we're going to be talking about how to treat about home remedies for different injuries that can occur in your home environment. Starting with burns. There are different types of burns. It can be a first degree burn, a second degree burn, or a third degree burn. The ones that we're really concerned about is really third degree burn. That person is burned quite severely and they have to go to hospital. But first degree burn is when you're burned, say for example with water and the skin sort of like a bit sore, and it has got boulders that are there or vesicles that are actually appearing on the skin. What happens then is that you just need to dunk your skin area with cold water, make sure that the area is cool, and then take some analgesia if you have something like Panado or ibuprofen that you have at home that would make the burning a bit less painful. From there you can just simply put a gauze and then you can go and see a doctor. For every burn you will still need to see a doctor, but by putting water and also applying a bandage and also taking some analgesia makes the pain a bit more bearable and gives you time to be able to see a doctor. The second thing that could happen is that you could have a broken arm or a leg, or whether you're running or children playing. What you would see usually is that how you would identify that a leg or an arm is broken, for example, is that there will be loss of function for that particular limb. So what that means is that the person will not be able to use that arm anymore. It will get swollen, it will even get very red when you're actually looking at it. That's usually a sign that it's actually quite broken. Now, the best thing to do is to try and avoid moving it as much as possible. If you can be able to splint it with a wooden board or anything that can prevent it from moving, and actually apply some crab bandage if you have, or even a cloth just so that it doesn't move, and you run that person to the hospital as quickly as possible. I always say try straightening up the arm or reducing the arm in any way by just simply splinting it and sending that person to the hospital. It is the best thing that can happen. Other things that could happen is insect bites, such as bee stings as well can happen. When you have an insect bite such as that, some people can actually be allergic to it. So what that means is that that person might start swelling up and it can actually close up the airway. That person would need to go to the emergency room as soon as possible. But the majority of us do not necessarily have that type of an allergic reaction. So you can actually go wait it out and actually see if the swelling is going away. If the swelling is not going away and it's actually progressing within 5 to 10 minutes, then that person needs to be seen. But most of the time, after 5 to 10 minutes, the swelling usually starts reducing and the person starts getting better. However, if you have been bitten by a snake, for example, a snake can be quite dangerous. Though the majority of snakes are not poisonous, we do have those that are quite poisonous. There are different types where when you're bitten, you find that it actually causes a lot of swelling of the limb, and sometimes the poison runs all the way with the blood and affects your nerves, and sometimes it can even just affect your skin as well. If you're bitten by a very poisonous snake, you can even lose your arm or your leg. So the best thing is for you to definitely go to the hospital as soon as you have been bitten. One of the teachings that used to happen in the past was that if you have to kill the snake and bring it to the hospital so that we can be able to identify it. We do not advocate for that anymore. Once you're bitten, just go straight to the hospital. What we also advise is that in order to avoid the poison from moving too fast, just apply a crab bandage around your whole leg. Make sure that it is not too tight, but yet tight enough to avoid too much blood movement. However, then let the doctors do the rest when they get to the hospital. Again, we also have pets such as dogs at home, which can sometimes bite. Now, a dog bite can also be equally dangerous because some dogs are actually not vaccinated. Now, unvaccinated dogs, you will never know whether the dog is vaccinated or not. Now, if you have been bitten, it's better for you to go to the hospital. But also what you need to do as well is to try and speak to the owner and find out if the dog is vaccinated against dangerous viruses that can actually cause problems for that particular individual. So rush to the doctor so that they can be able to give some injections that will prevent you from picking up those viruses. But most importantly, find out from the owner if it is if the dog was actually vaccinated. Now, sometimes when children are playing, or even when you're in the kitchen yourself, you might be able to sustain some cuts or some wounds which can actually cause significant bleeding in an area. The first thing that you do is to stop the bleeding. However deep or however small, however big the cut is, you need to try and stop the bleeding. So you are basically go and you apply. You can even use cold compression. In fact, cold compression is what we advocate most. So you can take some ice cubes, put them in a piece of cloth, and apply it on the skin for as long as you can. And then you go to the doctor. The reason why you need to go to the doctor for this is because when you get to the doctor within 12 hours of the wound actually being cut, the wound can actually still be sutured, and it can be closed quite neatly, and then you end up with a nice scar, and the healing time is much quicker than if you leave a wound open and nothing is done for it. So it's always good to go and see a doctor when you have a cut like that. So do not try and treat it in any way. Just apply cold compression and let the doctors do the rest. Now, sometimes now we're entering our festive season. When you're eating as much as you can, one can actually choke. Now, there is a simple maneuver that you can do if one of your friends or a family member or colleague is choking and they've eaten. By choking basically means that the food that was supposed to go down to the stomach is now going to the lungs, which is not where it's supposed to be. Therefore, air cannot move as easily as it's supposed to when you breathe in. Now, the Heimlich maneuver is the simplest way of doing it. This is where you put your fist like this, you go around the person, and you go right in between the breast, the two breasts, and then you simply just put a strong compression there. What does that is that it basically dislodges whatever that is sticking in the trachea or in the airway where this food is actually going to be lodging. Sometimes you might not be able to go behind this individual. This patient is already lying down. What you do, you basically just put your arms like this, and then you push right in between the breast, and then it's able to dislodge whatever that is there. Similarly, what could also happen is that when you're at home playing or working, you might sprain your leg or your arm in any way. Now, when you have a sprain, it's basically you can still walk and you can possibly still use that particular limb, but it's getting swollen and it's actually quite painful. Sprains as well need to be seen by a doctor, but what you can do before you see a doctor, again, if you have a crepe bandage or a piece of cloth, is to apply it in the area where the sprain is, and possibly elevate that particular limb, meaning that if you're sitting down, put it higher so that the swelling can actually be reduced, and go and see a doctor as well, because sometimes a sprain can be misleading whereas there's actually a broken bone that is there. So a proper evaluation would be highly appreciated. Again, when you're at home, there's also a risk of being electrocuted. There are certain electrocution that could happen. If you get electrocuted by touching a plug, for example, and you just have a small wave that runs into your body, that does not necessarily do much to you. But there is certain types of electrocution that could happen where it actually knocks you off and you become unconscious. If you are unconscious, then you definitely have to go and see a doctor, and you have to go to the emergency room where you can be attended to as quickly as possible. Because what happens is that electricity tends to damage some muscle fibers, and it can actually affect the heart, and the heart can actually stop beating because of it. Now, it's important for one to go to the emergency room and be able to be assisted there as quickly as possible. But if you just feel a shock wave that runs into your body and you're still breathing and you're still walking, it probably didn't do much damage to you in any way. So in that case, we don't recommend you to go and see a doctor. But if it runs you unconscious, it's important that you go and see a doctor.